Hello everybody. Today I'm going to talk about the rare diseases that openAI promises to solve in future, and it is going to hold exciting outcomes for the coming generation to treat rare diseases. So let us understand how is this openAI going to solve all these things. See, often in our day-to-day practice, we often hear our consultants saying that if you are getting a common diagnosis at the end of history and examination, then you are commonly correct, and if you are getting a rare diagnosis, then you are rarely correct. So right now, with the help of AI, I think that this dictum will change in future. So let us first understand why rare disease is so difficult to diagnose. We don't have domain expertise knowledge regarding that rare disease, because it itself is saying that it is a rare disease, so doctor does not have so much of exposure, and especially at the grassroots level. So diagnosing the disease early is often overlooked because the doctor himself does not have that kind of knowledge to diagnose that kind of disease. Second, after diagnosing the disease, okay fine, you are dealing with the rare disease, you should have the ability to analyze that which types of rare disease is this referring to, because rare disease in itself is not only a disease, it itself has a lot of entity inside it. So secondly, you should have the knowledge that how and what genes alterations or proteins would manifest in a particular type of symptoms and features, and we are and it is very difficult to get both these types of and it is very difficult to get and it is very difficult to correct these two shortcomings that we are presently seeing in our traditional health setup. But right now with AI, we are going to solve a lot of this problem quite in an efficient manner. So how come this OpenAI is solving this knowledge? So for this, you should understand that how AI is in itself changing. Right now, what we were thinking that is that AI is relearning platform, that whatever data you are going to feed into it, it is going to relearn and relearn and relearn, and then come out with certain outcomes. That is, what was the common understanding is that if a person is having certain kind of symptoms and disease, and if you are going to feed the data into the system, then with gradual period of time, the system will itself identify that okay fine, with these kinds of symptoms in these kinds of timeline, we can come out that this is the disease that it could be. But right now, what AI is changing is that it has crossed over the first step and it is about to cross the second step, that is, it is reinforcing. What is reinforcement here? Reinforcement is that whenever we are going to feed the data into a system, that system is not only going to correlate between okay fine, this was the symptoms and this is the disease, and now they are correlating both things. Now the AI has kind of jumped over this, and it has reached to a point where the AI itself will think okay fine, a patient is presenting with this kind of symptoms, then what disease would it be referring to, and from that disease it will be going towards the genes that it is possible for that rare disease or proteins, whatever the case may be. So in this reinforcement, the AI is itself thinking exactly like a human, and moreover more efficiently like human. More efficiently than a human may think, because AI itself will be much earlier able to diagnose this rare disease. Because why we are so much interested in this rare disease, because this rare disease often have a very long history period. If we intervene early, then we have better outcome chance. So right now, what you should be this is doing is that it is totally disrupting the way the disease has been taught, studied, and now it is stepping one step further away from human. That is, it is getting ahead from human, is that it is now thinking in its own way, in manner in which humans have not thought till now. And this was the first thing that I think that holds promise for the health sector, that whatever in the first 2 days I have witnessed in the OpenAI announcements. Now the second thing is that now AI is getting because it has now adopted the property of reinforcement, that is, it is not thinking in the way like as a human would think, and in many cases in a better way. So now these AI models, these AI, they are able to just pick up knowledge, pick up the base knowledge from the base problem from a simple diagram, and but just by analyzing that diagram, you just providing a setting of that diagram, you can come on to the conclusion. We come on to the every kind of things that you are going to face in this problem solving. So right now you won't be understanding what right now I'm saying, so I will just put the video section that that has been shown in the OpenAI announcement, and then you will understand it in a better way.
Wanted for everyday use cases that we've had requested a lot is multimodal inputs and image understanding, and Hyungwon is going to talk about that now.
Yep. To illustrate the multimodal input and reasoning, I created this toy problem with some hand-drawn diagrams and so on. So here it is. It's hard to see, so I already took a photo of this, and so let's look at this photo in a laptop. So once you upload the image into the ChatGPT, you can click on it and to see the zoomed-in version. So this is a system of a data center in space. So maybe in the future, we might want to train AI models in the space.
I think we should do that, but the power number looks a little low.
1 gigawatt.
1 gigawatt?
Yeah? Okay.
But the general idea, I think.
Rookie numbers.
Yeah, rookie numbers.
Okay. Yeah. So we have a sun right here taking in power on this solar panel, and then there's a small data center here.
It's exactly what they look like.
Yeah. GPU racks, and then pump, nice pump here. And one interesting thing about operation in space is that on Earth we can do air cooling, water cooling to cool down the GPUs, but in space there's nothing there, so we have to radiate this heat into the deep space, and that's why we need this giant radiator cooling panel. And this problem is about finding the lower bound estimate of the cooling panel area required to operate this 1 gigawatt data center.
Probably going to be very big.
Yeah. Let's see how big it is.
Let's see.
So that's the problem. I'm going to this prompt, and yeah, this is essentially asking for that. So let me hit go, and the model will think for seconds.
By the way, most people don't know, I've been working with Hyungwon for a long time. Hyungwon actually has a PhD in thermodynamics, which is totally unrelated to AI, and you always joke that you haven't been able to use your PhD work in your job until today. So you can trust Hyungwon on this analysis.
Finally. Thanks for hyping up. Now I really have to get this right. Okay, so the model finished thinking, only 10 seconds. It's a simple problem. So let's see if how the model did it. So power input. So first of all, this 1 gigawatt, that was only drawn in the paper. So the model was able to pick that up nicely. And then radiative heat transfer only, that's the thing I mentioned. So in space, nothing else. And then some simplifying choices. And one critical thing is that I intentionally made this problem underspecified, meaning that the critical parameter is a temperature of the cooling panel. I left it up so that we can test out the model's ability to handle ambiguity and so on. So the model was able to recognize that this is actually a unspecified but important parameter, and it actually picked the right range of temperature, which is about the room temperature. And with that, it continues to the analysis and does a whole bunch of things, and then found out the area, which is 2.42 million square meters. Just to get a sense of how big this is about 2% of the land area of San Francisco. This is huge.
Not that bad.
Not bad, yeah.
Oh, okay.
So now, after you have seen the video, you would be understanding now that AI is able to adopt the information just from looking onto a paper and just a diagram outline. So just think of what will it will hold for future. If right now they can see that fine, this is the diagram and these are the possibilities that we may face in space. like that, if a person with just with his social media accounts, or with his a celebrity who is being watched in some 3D theaters, are being watched by some AI applications, then they are going to be diagnosed early. So funny enough, in a coming situation, celebrities or the people with a lot of social media presence, they will have a better chance of diagnosing. They would have a better chance of diagnosis of rare disease, and that's going to be really great for the medical science, great for the humanity. Drug is perceived and used in treatment of patients, and there would be a lot of recovery. And one thing that I would like to share with you, with all the medical professionals who are interested in AI and all, that please go for and learn Python language, because in the coming future, if you want to take advantage of AI, then you should have basic knowledge of Python, and from that you can always write and code your own programs and everything, and this is going to be a really exciting future.